Another Zoom one.
Good evening, everyone. Can we hear me? Good evening, everyone. Can we all hear me?
Yes, we can hear you.
Please, if you can hear me, can you respond? Okay, welcome. We'll be starting at 8, but while we wait for others to join, please, when you join, kindly mute yourself. Please just please just check to ensure that you're muted so we don't have interruptions. Please just kindly check and mute yourself if you're not muted. Thank you.
But I did not pay it. But the money that I'm paying is I paid that 21, sorry, 14, 14.
Hello, I don't know if Lillian is there. Please help us meet anyone that is just joining.
Okay, good evening once again. Can we all hear me? All right, thank you very much, Vivian. You're all welcome to this webinar, and I'm I'm really excited about this program. I believe you are. I hope you're as excited as I am, because believe me when I say we have a lot in store for you. So um, it's 8 o'clock by my time, and we'll be starting now. But um, I'd like us to start with a word of prayer. So can we all say our prayers in our various dialects and religions? Just kindly say a word of prayer, and then, oh, sorry, kindly say a word of prayer and then we begin proper. Thank you. Okay, amen to our prayers. And if you're just joining us, welcome, welcome, welcome. We are so excited to have you on our first webinar, and I hope you're excited to be here. Like I said earlier, we have a lot in store for you. I hope you can all hear me. Please, if you can't hear me, just indicate. Okay, okay, thank you very much, Precious. So quickly, before we get into the webinar proper, I would like us to do a quick introduction. So please use the chat box, tell us your name, and please represent your country, represent your institution. Drop your name, the name of your institution, and your country. So we'll do that quickly in the next 2 minutes. Please kindly drop your drop your name, drop the name of your institution or the name of your country or in the chat box. Oh, thank you, Lillian. I can see Ahmadu Bello University. Please represent your country, represent your university. We want to hear from you. Okay, Chioma from University of Calabar, you're welcome. I can see Inabuke from Oyo State, Nigeria, you're welcome. I can see Precious from Lautech. Oh, a graduate of MedLab, you're very welcome. I can see Chukwuemeka from University of Lagos, you're welcome. Martha from Afe Babalola University, you're very welcome. We're glad to have you. I can see Omole from FM. I don't know what that is, but you're welcome. I can see Deborah from University of Ilorin. You're welcome. I can see Adebayo from FCT. You're welcome. Oh, we have someone from Cotonou. You're very welcome. I can see Ahmad from Kenya. You're welcome. Olajide from Bowen University. You're welcome. Dr. Eric from Kenya. We are glad to have you. Oh, I can see Ken from University of Bukavu. You're very welcome. Regina from FCT. Tochukwu from Ahmad Bello University. Aliyu from Gwagwalada. You're welcome. I can see Grace from University of Calabar. You're welcome. You're all welcome, and we are glad to have you. So shortly, I'll be calling on our. Oh, I'm so sorry. I forgot to introduce myself. My name is Janet Afoti. I am the communications manager for Equity Strategy, and I will be the moderator for this session. So shortly, I'll be calling on our speaker for the day. Okay, so I'll be calling on our speaker for the day to tell us about the organization, and then we get into the webinar proper. So please help me make welcome Joshua Aluga, the our speaker for today. Use your chat box and let me see the emojis come in. Welcome him. Joshua Aluga, you have the floor, sir.
Please, can you all hear me? Please, can you all hear me?
Yes, we can.
We can. Yes, we can.
Come in, give me a minute, please. Okay, thank you everyone for coming. As stated earlier, please, can you still hear me?
Yes, we can hear you.
Okay, that's good. So, my name is Joshua Luka. I'm the director of EcoQuest Strategies. I will be taking you on the basics of policy and advocacy. We'll have a discussion at the end of that. So, before we go ahead, I would like to first introduce what we are standing for as an organization, so that all of you can be in line with what we are doing. So, and please give me a minute. I'll be sharing my screen now so that we can just move ahead. Okay. Please, can you all see my screen?
Yes, yes.
Yes.
Okay, thank you very much. So I would like to say thank you everyone for coming. My name is Joshua Luka. I'm the Managing Director of EcoQuest Strategies. I've worked with Nigerian Medical Student Association, Federation of African Medical Student Association, also in the International Federation of Medical Student Association, and also I've also worked with other international organizations. So I'm basically working with more of in the area of health policy. So I'll be discussing more on what policy is, what advocacy is. We are going to look at the multiple streams framework, and we're also going to look at how to set we'll discuss more about agenda setting. But before we go ahead, I'll first introduce what an EcoQuest strategy is. EcoQuest strategy is a non-profit organization. It started this year. What we are trying to do is that we're trying to create a platform or a place whereby young people in Nigeria and Africa will be able to learn more about health policy, and not just learn about health policy, so that they can also gain those skills so that they'll be able to advocate and create change at their different local communities. And we have discovered one of the major things that made us to one of the major things we stand on is we have realized that in Africa, health is actually a problem, both in Nigeria and in Africa. Healthcare is usually not given much priority and the rest. And a lot of policies are set, most of them are not implemented the right way. Our for our decision makers, there's a lot of issues with political will. And we believe that when young people are motivated and when young people can stand and make their decision makers accountable and also demand for good healthcare in Nigeria and Africa entirely, it will actually create a drastic change in health promotion. So we are also basically looking at how we'll be able to enable young people to influence policies and also in health promotion. That's what we are looking at. So I'll move into the next slide now. So our vision is actually looking at whereby we are looking at a place whereby all African people have access to quality and affordable healthcare. That's the vision we are looking into, whereby people no longer need to spend their entire savings to look for healthcare. People don't need to move from a far distance to go and look for healthcare and not even have the access to healthcare they need or have access to quality healthcare. So we are looking at our vision is looking at an Africa where this is available. So as I stated earlier, our mission is how we'll be able to strengthen young people to influence health policy and promote evidence-based decision making. This is at all levels, at community level, at national level, at national level, and also in the continental level. That's what we are looking at. And we realize that we have seen that most young people don't usually have these skills and don't have the understanding of just even health policy itself. So we are looking at how we'll be able to strengthen them to know more about this. So, and as an organization, we stand at the core value of having excellence. If you ensure, what most of what we do, we ensure that there's excellence there. We ensure impact, creativity, and partnership. So this is our core values as an organization. Then most of our, these are basically what most of our activities are. Activities are around capacity building programs. For instance, this webinar itself, we are looking at how policy advocacy. If you check most of our posts on social media and the rest, we are basically looking at most of our posts is basically about policy analysis in the health sector. We also focus on health communications. You can see us releasing Nigeria Health Reports, whereby for now we are more focused on reporting of Nigeria. So most of what is currently happening in the health sector of Nigeria, we are basically reporting it so that everybody will be aware of what is happening, and also community outreach. So these are where our activities are around. So, and that's basically it. And I think I'll be stopping here and before we go ahead to the main program of today. Thank you very much.
Okay, thank you very much, Joshua Aluga, for that insightful introduction. And okay, before we get into the webinar proper, I believe you've been told that there'll be certificates at the end of the session. So yes, we're keeping to our promises, and then we are giving out certificates. But certificates will only be awarded to those that fill in the post-evaluation form. It will be open for just 10 minutes after the session. So please, I'll drop the link in the chat box. Kindly fill it in. And I also like to encourage us to share the certificate across our social media platforms and tag Epicare Strategies. If you're on LinkedIn, please share the certificate on your profile, on your LinkedIn page. Share it on your Instagram, your Facebook, your Twitter, or is it X now? Just share it across your social media platforms and remember to tag us. Kindly remember to tag us. So I'll drop the link now. Please kindly fill it as soon as you see it, because it will be closed 10 minutes after the session is over and you don't want to miss your certificate. So please remember to fill in the form. I'll still be calling on Joshua Liga now to take us on to the session proper. So Joshua Liga, you have the floor. Thank you.
Okay, thank you very much. And concerning the evaluation form, please, and I would like that to be voted for now. And for again, I would like to add concerning, please, I don't know if I'm still loud because I saw in the chat box that I'm not that loud. I don't know. Please, am I audible?
Yes, you're audible.
Okay. So good. And concerning the post-evaluation form, we'll fill it because if you have not gone through the training, you might not be able to answer some of the questions. So, and for concerning the post-evaluation form, please just pay attention to us throughout the training because we are giving you certificate. So we actually want you to understand what we are doing. So, and at the end of the training, at the end of this session, we'll have a little activity to discuss. Then after then, the evaluation form, you can fill in the evaluation form. We just have 10 minutes for you to fill in so that we ensure that it's only people that are on this call that are filling the form. So, and thank you very much. I'll be sharing my screen now. And please, what we are actually going to discuss now is something very important. I would like each and every one of us to pay rapt attention. So I'll be sharing my screen now as I go ahead. Please, can you see my screen?
Yes, we can.
Okay, thank you very much. So, first of all, this first section, we are going to look at the policy circle and problem tree analysis. So, basically, we are going to look at policy circle itself, and we're also going to look at problem analysis. This problem analysis is most, we are trying to make you to understand where agenda setting comes in. In our subsequent program, we'll discuss more on stakeholder analysis and the rest so that you get enough understanding of the entire dynamics of policy development. But for now, we'll look at the policy circle and look at the problem tree. Then later on, after this part, we'll go to the multiple streams framework and before we go for our activity. So, for us now to start, we first need to establish the understanding so that everyone will know what even the policy is in the first place. Please, if at any point my voice is not clear, please let me know. Am I more louder now?
You're
Yes, sir.
audible. We can hear you.
Okay, good. So now when we are talking about policy, policy basically is either an organization or a government planning on achieving particular goal.
We can't hear you clearly.
Okay, you want me now?
Your voice has completely ceased.
Wow. I never. Okay, please, can you hear me now?
Yes, we can hear you now.
Okay, so I'll be using this other device to speak to all of you. So, and when we are talking about a policy in the first place, a policy is either a decision when a government or an organization have reached a particular decision that they want to achieve a particular goal. Now, let's say in Nigeria, for instance, we have seen that access to healthcare now is a problem, or maybe healthcare is no more affordable. So the country, what we are looking at a situation whereby we'll be able to reduce this the level of where people won't be able to afford healthcare. So the government will be looking at, okay, let's say we are going to ensure that we have mandatory health insurance in the first place. So they might set this as a policy. Now, I'll also discuss more of what, so that I'll be able to know the dynamics, the difference between policy. Law is not a policy. So so that means that's where you come and see where they are talking about an act and the rest. But when we are looking at policies, most of the time they are usually referred as guidelines, strategy, framework, plans, rules, or principles. You most of the time where you see this is when you see and go to most likely World Health Organization. You can see they will talk about they have a particular strategy, 2030 strategy on ending, let's say, maternal mortality, for instance. So they have made that decision that this is how we plan on achieving a particular goal or objective. We want to reduce the cases of maternal mortality. So this is how we are going to do this. This is how we'll do it, this way. We'll do it this way. So now this is a policy that has been established. So now, now I would like to state that laws are not policies. Now, the thing is that most of the time, the reason why people people will want it to be a law in such a way that, and because when you break when you breach a law, there are usually sanctions. So most of our, let me use the word politicians or decision makers, they have seen and they have realized that when they just if it's just a policy, they have no, how will I say, it's not like they must do it. They may choose not to do it, and you can't not take the you can't take them to court or anything to go and say that you are supposed to do this, or there's no anything that is binding there. So the thing is that they usually, and that's why you see they usually go with an act and the rest. That one is now a law, and it will ensure that most of our decision makers will try to abide by that because it's just there. But when we say that this is a policy, this is how we plan on doing it, we have just realized that this is the best way to do it. And so people will try and work in that extent. I'll give you an example, and the primary healthcare under one roof policy. Now, what they have realized that there's a sort of fragmentation in the area of primary healthcare, access to primary healthcare. They have realized that and when they leave primary healthcare, before primary healthcare is just like maybe a particular local government, let's say your local government, let me just use and maybe a particular local government, I'm in Zaria, so I'll say a particular local government in Zaria now, they are in charge of their primary healthcare. That is okay. Now, what is there is that the state itself has no, and how will I put it this way? They don't have a way or a strategy in which they'll be able to monitor and be able to, let's say, fund these primary healthcare facilities. So what they realized that they noticed that those fragmentation is actually a problem. So what they did is that they brought them together. That's why they say under one roof. So they brought in a policy that will be able to take in everyone, that will be able to take in, or a guideline or a strategy that will be able to take in everyone. So they created State Primary Healthcare Development Board. Now, these ones now will be able to monitor all the primary healthcare centers in the state. So it is not just that primary healthcare are just there by maybe a local government, and who cares? Nobody cares what they do at that particular local government. So, but this time around, it's under a state. The state will monitor each and everything that is happening there, and the state will report to the federal government. So this is a policy in which they'll be able to reduce the issue of fragmentation. So now I'll be able to explain and establish what a policy is, I guess so. So now let's look at the policy circle itself. Now, for you to develop a policy, there's a circle that it goes into. Now, the first on the list is issue identification. This is a situation where people realize that it's a problem. Let me put it that way. People realize that it's a problem. There are a lot of things that I will go back to Kingdom. And when I talked about the multiple streams framework, you understand that more. So now, people don't identify, people have not identified there is a problem, and so there is nothing that is being done about it. Now, this is where agenda setting is. That's the issue identification. Now, if you realize that, and I just in Nigeria, okay, now, please, sorry for those that are not in Nigeria. Nigeria just finished their elections. Now, most of the politicians have an agenda. You might see a 10 agenda or a 20 agenda. Now, the reason why your current problem, I would say your current problem, maybe the reason why some things are not on that particular 10 list of 10 things is because they have not identified it. The politicians have not identified that it is a problem for them. They believe that it's not actually a problem that needs an urgent attention. Let's put it that way. So they didn't identify. It's not identified as a problem. They just say that, okay, people can actually manage it. People can find their way around it. So it's not on their agenda. Now, that's where policy advocacy comes in. I'll discuss more of policy advocacy, and advocacy itself. Now, when you see people advocating for things, they are trying to ensure that this is identified as a problem. They are trying to, I don't like to use the word cajole people, or but you are trying to push it in so that everyone will realize that this is a problem, this is actually a problem, this is actually a problem, this is actually a problem, so that our decision makers now will start acting on it. So that's the first part, issue identification. Now, when this issue is identified, what is being done now is the data research analysis for policy making. Now, you identify the problem. So now how would you fix the problem? That's where you come and do research and the rest, so that you identify the best way that these problems can be fixed. Now, when you identify how to fix this issue, you haven't completely identified how to fix it. Let me put it that way. Because if I say you have completely identified, the circle won't go. So you haven't completely identified, but you have identified key ways of solving this issue. Now, you formulate a particular policy now, a particular strategy on how this problem can be fixed. Now, when you identify that, the major thing now is consultations. Now, you have just have like an idea of the problem itself. Now, please take note that this issue identification itself, you won't just, after the issue identification, the data research analysis comes in. This data research and analysis now for policy making, there is what we call needs assessment and the rest, where you need to go, maybe there's a particular community and the rest, you need to assess and what's actually a problem itself, because you have identified the problem, but what is causing the problem itself. You also need, because you won't just sit down in your room and believe that this is the cause of the problem. Now, you can't sit in your room now. Let me give you a scenario. You can't sit in your room and say that the reason why people in your village are not going to school is because there is no primary school, or there is no school in your community. It might feel, you may feel like that's the cause, but it might not be the cause. So you have to research, meet those people that are most affected, and ask them questions. That's where this comes in. These consultations is also part of it. You also ask questions. Now, for this consultation, it's more of meeting experts. You also need experts here and here, both sides, but you also need experts majorly here. Good, so that they can review what you are currently having. Now, this is the consultations now, so that they will review and do everything. Now, for this, as I stated earlier, the reason why your people in your community are not going to school is because the people believe that maybe their culture doesn't support people going to school. If you go to school, you are weak or you are something. So that might be part of their culture. So you need to fix the culture, not just building schools. I understand that building schools is important, but you also need to fix that too. So that's where you need to research. You don't just believe that that's the problem. That's just the problem. That's what is causing it. So now for this consultation, you need to meet experts. After you have developed a strategy, you need to meet experts and get insights from them too. So now after this part, after the consultations, the policy itself will be adjusted and everything. Then it will be sent for adoption. Now there is a body that will adopt it, either in an organization or in the government itself. For Nigeria, there's a National Health Council that adopts this. They will adopt the particular policy. Now after it is adopted, then the implementation comes in. This is where most of the problem is, this policy implementation part. Now, people have realized that, okay, we have now agreed that all states should have a state primary healthcare board or agency that will monitor primary healthcare facilities in that particular state. Now, after they have adopted it and everything, states now will refuse to do it, or they might be slacking, let me put it that way, in implementing it. So now you see problems comes in here. This is one of the major problems. These two are one of the major problems, because this ones, it might not be so much issue, but these 2, 6 and 7, that's where problems comes in. Now, after it is implemented, okay, let's say it's implemented quite all right, most people will not monitor and evaluate what they are currently doing. Now, you understand that for this particular training, before you sign up for the training, you have to fill in your registration form. There's a pre-evaluation form, like it's attached. Your understanding was evaluated. So now after the training again, it will still be evaluated, so that I'll be able to understand whether what you have done has worked or not worked. If there is need for us to adjust, we also adjust. Now, this is where policy monitoring and evaluation comes in. Now, this monitoring now, It's during the process. You'll be checking whether it's in alignment with what you agreed here. You agreed that they should have state primary healthcare development, state primary healthcare development board in every state. Now, when you are monitoring, you discover that some states are still using their Ministry of Health as the state primary healthcare development board. They are not following to what was said here. You understand? So this is the monitoring. Evaluation now, you are checking after everything, whether it's working or it has worked in reducing the lack of access to healthcare, because primary healthcare is the first point of contact, whether it has done that. Now, after you have done that, now after you have evaluated it, now after evaluated, you discover another problem again. Now, the problem we have discovered now is back here. This policy implementation that some states, Ministry of Health, are not, let me put it that way, Ministry of Health are still using the Ministry of Health as the state primary healthcare development agency. So now you have identified another issue. So you now go and do research and discover how you'll be able to fix that issue. You consult experts, you create another strategy, and you keep on going and over again. That's how it is. Now, policy itself is a very complex process. This adoption here is a very, very complex problem, because before a policy is even adopted or it's identified as an issue, is a big problem. So if you are seeing a circle here, it's not actually a circle, it is a zigzag line. Please, can you see my cursor? So the real process, if you can see the real process is like this. It's very haphazard. That's how the real process is. But this is just showing you how it is, make it in a more simpler form. But it's a very complex process. So now let me move to my next slide. So now we are going to look at basically agenda settings now. But for us to look at agenda setting, we are going to establish a fact now. The problem, and we are going to look at problem analysis now. Now, I say in subsequent programs, we are going to look at stakeholder analysis and the rest. But for now, let's look at problem analysis. How will you identify that this is actually a problem? Now, a problem is an undesirable condition or situation proposed for solution. Now, when you are currently under a condition that it is not, that you don't believe that needs a solution, it's not a problem. You're just under a bad condition. That's just, let me just put it that way. It's when you believe that it needs to be fixed, that's when it becomes a problem. It changes its name from undesirable condition to a problem. I hope that is clear. Now, this problem tree is most used by program managers, let me put it that way. They use this as the method to identify problems, their causes and effects. It's actually something very simple. Now, the problem tree, you know how a tree is exactly. So it has a root, a trunk, and branches. That's how it is. Now, let me go to the next slide. Good. Now, here is the root. Now, this root are the causes. This is the main problem itself. Please pay attention here, because most of our activity will basically be around this. So, this is the main problem. You identified that maternal mortality is high in Nigeria. Now, what is causing the high rates of maternal mortality in Nigeria? You can go ahead and even say you can go ahead, most of the causes can be even illiteracy, can be lack of access to private, lack of access to healthcare, because that's the first point of contact. People don't go for antenatal clinics and the rest. We can look at illiteracy, we can look at a lot of things that might cause this, right? So there are a lot of causes that might cause this. Now, these are the root causes. Now, then the tree now itself, the leaves and everything, they are the consequences. I just want us to please understand at this point. So the main problem is the trunk, the roots is the causes, then the consequences are now at the branches. I just hope we all understand this at this point. It's actually something very simple. Now, the trunk, as I said, represent the core problem to be solved. The roots represent the causes of the core problem, and the branches represent the effects or consequences of the problem. I just hope it is now clear now. So, and you as a person now, if there is any issue you are currently identifying, either your organization or in your work as maybe there's a particular thing that you need to establish, maybe in your work as a manager or something exactly like that. This can be used in literally everything, like literally everything they use this. So you will first identify this is the problem that you are currently facing. So now you have to brainstorm what is actually can be the causes of this thing. It might be a lot of things that might be causing it. Then you also look at the consequences. Now you also need to look at the consequences so that you see the impact of the effects of this problem on a lot of people, so that you know how extreme it is. So now, from here now, we'll be looking at the multiple streams framework and policy advocacy. Now, this will enable you to still understand more of problem analysis itself, and be able to also understand how policy advocacy works. Now, I will still discuss more on how I will discuss on how what advocacy is itself, and discuss more on multiple streams framework. Now, this multiple stream framework was developed by, it's a model developed by John Kingdom. You can check him out. This is just an overview. Now, it describes agenda settings of a policy process itself in relation to three streams. Now, this is where the complexities of policy of policy itself comes in. Now, the three streams he was able to identify is political stream, problem stream, and policy stream. Now, for you to create a window of opportunity, now this window of opportunity is when that's the agenda setting. When your politicians now will bring this, what will happen or what will collide to bring in this window of opportunity, whereby your politicians or your decision makers will realize that this is actually a problem. So you have to look at these three must click together. Politics must click together, problem must click together, and also the policy itself must click together. I'll explain this further. Now, this is just a diagram discussing it. Now, this problem stream now, I've already explained it to you. When you identify that as a problem, now this stream now can be affected by a lot of factors based on just your normal perspective as an individual, or maybe the decision maker himself may believe that it is not a problem. You understand, right? Now, we know what we call policy entrepreneurs too. These ones are selling the policy. Let me just put it that way. Now, we have what we call advocates. Let me finish with this first. Now, we know what we call advocates. Now, this that's what most of policy advocacy comes in now. These policy advocates now will try selling either an idea or an opinion, or will start calling, or maybe just normal advocates now will start saying, either making campaigns or the rest, that maternal mortality is a problem. Maternal mortality is a problem. I'm just giving an example. Now, this is when they push it around and make it in such a way that people will identify that this is a problem. So our decision makers will understand that it's a problem. So it is established as a problem. Now, policy stream now is when a lot of things, this primeval soup now, a lot of people will bring in their ideas that this is how this problem can be fixed, this is how this problem can be fixed. So there's a lot of collisions of how these things can be fixed, right? Then we have the policy stream now, where elections comes in, or the national mood, or maybe somebody's coming, maybe you hear terrorists in Nigeria have started causing a particular problem. Now, when that is happening, everywhere will just be the political politics itself will completely be in chaos. A lot of people don't want to spoil in their tenure or the rest. So they will identify that security is the number one top priority. Now, when they identify that security is the number one top priority, they will start looking for how this problem can be solved. So this is where these policy entrepreneurs comes in. They'll start selling their ideas. So when they start selling their ideas, this has already been established by either, let's them just be terrorists, and they start causing problem and identify that there's insurgency in the country. Security is a big problem, right? Now, people start selling ideas of these policy entrepreneurs that this is how to fix insecurity. Now, their politics now comes in. Maybe the governor is trying to, maybe there's a new election on ground. So one of the major things they will believe that is security that is a problem. Now, the same thing economy too. A lot of people are going into poverty. Now, people are giving their own opinions on how to fix this issue, how to revive the economy. So you might see policies like Naira, and for Nigeria, you might see things like redesign of the Naira now. So now this politics stream now, it's when it's at the mood, either an election or something like that. that is causing them to feel like, we need to do this if we want to secure the next election or win the next election. So now this is it. So when these three things collide at a particular point, it will create a window of opportunity where policies can be adopted. So a new item can go into the agenda of those decision makers. So this is what Kingdom was able to explain. That's the multiple streams framework. John Kingdom, 3 streams: political stream, problem stream, and policy stream. I just hope it is clear now. So now let's look at what policy advocacy is itself. Now, when we are looking at what advocacy is when you are trying to represent or promote or defend either your own interest or people's interest of a particular opinion itself. That's advocacy, right? When you are trying to promote or defend a person. When I say defend a person now, it might be people living with HIV. We are trying to defend their interest. That's number one. It might be you are trying to protect the interest of people with disabilities. That's part of it. Now, this is advocacy itself. Now, when you are looking at policy advocacy, that means you are trying to represent, promote a particular policy, promote or defend. It might even be to defend a particular policy or to promote a particular opinion that will become a policy. Now, this includes approaches that can be done either by organizations, coalitions, to change or preserve a specific government programs, either programs or they will try to influence how decisions are made. Decisions can be how policies are being set. So this is it. That's policy advocacy. Now, this policy advocacy that we are talking about, when people are trying to promote a particular opinion or a particular opinion, let me put it in that way, a particular opinion or a particular approach of doing things. Now, they can do this either confrontational way, or they can do it in a cooperative way. They can do it by bringing in their evidence or based on their particular interest. It's basically a mix of this. So now it can take different forms. Let me put it that way. Now we have who we call advisors or think tanks. You might heard of what we call think tanks. Now what they basically do is that when there is need for a particular policy, they bring in these experts or these advisors. You might see what we call policy advisors at the rest. Now these people are using evidence to create policies, not just based on what they think. Let me put it that way. And they are more cooperative because they are working with decision makers to do this. They are basically advisors. So they do it in a more cooperative and evidence-based approach. That's what they do. Now we have what we call lobbying. Now, for people that are just hearing of lobbying now, you might see that lobbying, it might not be actually used, maybe used in a negative sense. Let me put it that way. Now, this lobbying now is also a very important part of policy advocacy. Now, this lobbying I'm telling you about now is what some organizations might do. Now, let me just put it in this way. Now, let me just use alcohol industries, for instance. Now, they realize that people are complaining of non-communicable disease. Alcohol causes a lot of diseases, tons of diseases, kills a lot of people. Now, if there is a ban on alcohol, that means your company, if you are selling alcohol, will be screwed. And I'm sorry for using that word, we messed up completely. So you will lobby decision makers in such a way that anytime anybody is talking about setting a ban on alcohol, it will not even pass, it will not go anywhere. They will shut you down completely. Not like, I wouldn't say shut it down like completely, but it won't go through. Let me put it that way. So they will lobby in such a way that this will not happen, so that their industry or their interest will be saved. Now, this I'm just giving you in a more negative sense so that you understand it. But it is also done in a positive sense, whereby a particular organization or a particular company or a particular organization, basically companies use this. Maybe there's okay, let me just use this for instance. Please, if you are not from Nigeria, sorry for using that. Maybe there's a close of border now. So let's say a particular company, let's say Dangote now, have realized that when the border is closed, he won't be able to do a lot of things. It will affect his company. So he will lobby decision makers in such a way that even there will be a policy for imports, let's say for imports, it's okay. Let's just put it in such a way they want to close the border permanently. There's no import or export. Let me just put it that way. So you ensure in such a way that all his products are being exported. So you claim that if his products are being exported, the country will gain a lot, the economy will be boosted. So that might be what you might use to lobby. Now, this is also part of policy advocacy. Now, there's media campaigning where most people are aware of now. Everyone is aware of this. It is confrontational, you get my point, but it's not extreme like activism. So in this way, they usually use evidence to do this. So you see on social media, on your TV, they will keep on talking about a particular thing. I will keep on using maternal mortality. They'll be talking about that maternal mortality is a problem in Nigeria. Maternal mortality is a problem in Nigeria. So this, they might be doing it. They are more confrontational, but it's evidence-based. Now, sorry for that. So the next one now is activism. Activism is also confrontational, but it's extreme. That's where you see a lot of people doing, and how will I put it that way? When I say confrontational, they might go and close down the road and be as advocates of climate change or something like that. So you might see it in a very extreme way. They might do it this way. So that's activism itself. So you might see activism during the NSAS protest too. So that is part of it. So now let me go to the next one. So then I think we are done with this. I will be taking questions now. So thank you very much, everyone, for listening. After this, we'll go into the next agenda on the program. We're basically looking at the activity. So thank you, everyone. Please, can you all hear me?
Very well, we can hear you.
Very well, we can
Yes,
hear
we
you,
can
sir.
hear you, sir.
Thank you very much. So I don't know if there's any question. I don't know, Jen, are you here?
Yeah, there is a question that I want to be cleared of. You talk about
Okay.
policy stream, political stream, and all of them. Please, can you at least show more light on it because I'm still confused about it.
Okay. Okay. I'm coming. Please, can you see my screen?
Yes, I'm seeing.
Okay, good. So now, this policy, this stream now, politics, problem, and policy. Now, what Kingdom and John Kingdom was able to establish was that, in a scenario whereby these people, let me just use decision makers, who identify, who put this on their agenda, that, how will I say, where our agenda can be, a new item on agenda can be created, a new item will be set on agenda. Now, let's say in Nigeria now, economy is a big problem, and insecurity is a big problem. So this is on the agenda of almost every decision maker. Every politician will say that this will be on his agenda, top priority. Now, for this security now to be on his agenda, security has been an issue since Nigeria was, since 1960, let me put it that way. Why I'm telling you that is because there was still kidnapping. Kidnapping was going on in this country. A lot of things are going on, but most of the decision makers, let me just put it that way, didn't take it as a major big priority. Let me put it that way. They didn't take it as a major priority. Or let me just put it the economy itself. Let me put the economy. Now, 10 years back or 20 years back, it's not take the economy itself as a very, very big problem. But when these three things came in, politics, policy, and problem came in, they're able to create a new thing on the agenda that we actually need to create a policy that will be able to fix this problem. So first of all, what happened is that the economy was crashing. A lot of people were complaining. So they identified that this is a problem that needs to be fixed. Then the policy stream now comes in. A lot of people were saying that, we this is how to fix it, this is how to fix it, this is how to fix it. Then politics came in. Now let me show you, make it this way. Just look at this side of the diagram. Here, nothing is clashing, right? They are not clashing here, but they clashed here. When they clashed here was that politics came in, policy stream came in, and problem came, all of them, the three of them came in. Now, when these three things collided, it created maybe it created an effect, let's just say an effect that made the decision makers to say that, this is actually something that we need to fix. We need to fix it right now, and it's very urgent. So when sometimes you might just have this problem, right? But politics is not there. So all your shouting that is a problem will not go anywhere. It will remain here, where nothing is happening. So nothing will join in. Now, you might have a lot of ideas on how to fix your economy, but when people don't identify that the economy is a problem, or there is not anything in politics that will make them to put it on their agenda, now it will not go anywhere. So the three of them individually will not make it to be on the agenda of the government that let's fix this thing right now. All of them must come together. During elections, let me use elections now, most of the politicians will keep on saying that I'll fix your economy, I'll fix your economy, I'll fix your economy. So the economy will be on the agenda. This is the politics part of it. Now, the policy stream now, a lot of people will say this is how to fix the economy. So it will come in. Then people identify that it is a problem. So when all of them now come together, a new agenda will be formed that let's fix this thing right now. So a policy window will be created whereby policies can be adopted by the government. I don't know if it is clear now.
Yes, I understand now.
Okay, thank you very much.
So where does the kingdom come in?
Oh, Kingdom is actually the person that brought this model, John Kingdom. They can call him John Kingdom's model. So it's actually the person that brought the model. That's John Kingdom. You can see it's a multiple stream framework developed by John Kingdom. I hope it is clear.
Yes, thank you.
Okay.
Thank you very much, Joshua. I hope I'm being heard.
Yeah, we can hear you.
Okay, thank you so much for the explanation and everything. I'm so particularly interested in one of your major keywords you kept using, which is maternal mortality in Nigeria. To me, it is a personal thing, but I want to also throw in a question regarding that as well. Please, I don't know whether you can you be more practical when it comes to policy making and advocacy regarding this particular subject matter? For example, how can we, as a people, like me particularly, how can I start this? If I want to, begin something similar in that line of maternal mortality, can you just be a little bit practical, relating it with maternal mortality, for example?
Okay, thank you very much. So
using the stages you mentioned, yes.
Okay, thank you very much. I understand what you are trying to say. Now, that's why I brought in policy advocacy into part of it. Now, you might not be wait, let me share my screen. So you might not be there in the forefront developing a particular policy. You get my point? So what you as a person can do is to advocate for certain policy changes. Let me put it this way. That's what you as a person can do. That's why I was bringing in policy advocacy itself, where you're trying to promote a particular opinion or interest. Now, if you understand my point, so you understand that maternal mortality is a problem. So you call your government to action that we should ensure that healthcare is more accessible to pregnant women. There should be more antenatal care clinics should be more closer to people. Primary healthcare should be optimized. So there's a lot of things that you have on your list that this should be optimized so that this high level of maternal mortality can be reduced. Now, when you are able to establish this either do most especially what most people do is media campaigning. So if you are able to establish this and ensure that apart from media campaign, you can do normal campaigning. Let me put it that way, so that you won't just be limited to this. So when you have established extensively that this is a problem and this you are calling them to action, either in your particular community or in maybe nationally or anywhere, just in your particular community, this is what they should do. Maybe your local government chairman, this is what they should do, or maybe a particular decision makers. If you be able to gather a lot of people, they're able to support this mission or support this call to decision makers, then you are able to effect change at that particular location you are. I'm just making it in such a way that it is more local now. So you are now when you are doing the campaign, and that's why evidence is, you just don't believe that there are high level of maternal mortality and rest. So you have to bring in your own evidence and show them and the rest. So this is where it comes in. Now, when your decision makers now have realized that it is a big problem, well, then it comes during their election time or something like that. So now it is during their election. That's politics has been fixed. Now, the second one is their policy stream. You have established that they should do this, they should do this, they should do that. That's a policy stream. Now, the third one now is a problem. I've already established that is a problem. So now when these three collide, that's when policy now can be created and adopted. I don't know if it is, I'm able to answer your question now.
Yeah, in a way, it did.
In a way, okay.
Hello.
So I think we'll hold on with the question for now. We actually
So
need to
I would like
discuss
to ask
some.
the last question. Can you allow me to
Okay,
ask the question?
okay, you can go
Thank you
ahead.
thank you for the wonderful presentation. So I would like you to actually shed more light on the interest based why you are trying to explain lobbying as a form of advocacy. You say that it is interest based.
I didn't hear you. I didn't hear you.
I said that when you were trying to explain lobbying as a form of advocacy, you say that it is interest based. Does it actually mean that they are trying to advocate for their personal gain or something like that?
Yeah. It's more of personal, not like personal interest. It might be an organization itself. Maybe this lobbying, right? It's been done. It's one of the most common thing that is being done. Most of these programs that you see, let's say there's a UN General Assembly or something like that. So there is actually a part whereby people actually lobby, organizations lobby. Maybe you have a particular organization and you're present there, and maybe there is a particular agenda that you want it to be adopted at that particular setting. You might go behind and talk to most of the people that will be able to vote on those issues and get them on your side. You get, so this is your own interest. You want that there should be more training for nurses in Africa. Let's put it that way. So this is part of the agenda. So you can lobby some other let's say member state or something like that to be able to support what you are doing. Now, I'm just putting this one in a high level way. Now, it might be just locally where you have maybe a particular organization or something. You are trying to push in an idea on. See, there is a lot of problem. Let me put it that way. Everybody there's a lot of problem everywhere. Now, when your own particular, you are actually interested. Now, because I'm interested in non-communicable disease, means there's no communicable disease. There are communicable diseases. So I'll try to push in my own interest of non-communicable disease so that more priority will be given to those areas. This is my own interest. But communicable disease is also a very important thing. You understand my point now? So they might lobby in a particular interest. So it might not just be your own personal gain or something like that. So when it is personal gain, that's when it might be in another way. So that I think this personal one is when what people generally think lobbying is your own personal interest or maybe selfishness or something like that. That's what people generally think is it. But we also lobbying covers a lot of things. Please, I don't know if I'm able to answer your question.
Yeah, definitely. I understand better. Thank you.
Okay, so please, if you have a question now, we'll send our email. You can just, or maybe we'll just put the email so that the slides will be shared. So I would like to go ahead we will start our activity now. So please give me a minute. So this is actually something we'll do. Everyone is going to do. So we are supposed to be divided into two groups based on identified policy issues in Nigeria. I won't be the one talking here. It will be more all of you talking. So and all of you will be bringing in your own opinion. It's just be like a reflective session. So now we'll be divided into two groups, but see, the nature of the Zoom call, there is no an option for creating rooms. We wanted that to be done, but I don't think it can be done. So what we are going to do is that we all will discuss these things together, each and every one of us. But please mind you, I won't be talking here. Most of you will be talking. So I don't know if Jane is here. She's the one moderating the session. Please, Jane, are you here? I don't know if she's having network issues. Please, Jane, can you hear me? I think she's having network issues. So not to waste time, I think, please, anytime you, okay, she's here. Please, Jane, can you hear me?
Yes, I can.
Okay, please, you can go ahead. So there's no option for creating rooms. So what we need is that we'll first discuss the first one, then we'll discuss the second one, and we'll discuss the third one. That's just it. So for the first one, we'll discuss, I'll just tell me to move to the next slide anytime. So you can go ahead, please. John, please, can you hear me? Please, she's having network issues, so I'll go ahead. So please, can all of you hear me?
Yes, we are hearing you.
Yes, we
Okay,
can.
so we'll be working on drafting a problem tree for a policy issue. That's what we're going to do. Then we'll discuss on interventions on how we'll be able to target the root causes. And all of you now are aware of the tree, the root of the tree, the trunk of the tree, and everything. Then for this might not actually work, we'll just bring in some people to talk, and that will just be reflection since we don't have the options now. So I will go back to the slide. So we are going to discuss first on poor health insurance coverage in Nigeria. And poor health insurance coverage in Nigeria. That's what we are going to discuss now. So good. So now this is how it is. So I would like everyone now, please, you raise up your hand, then I'll call you, then you speak. So now, low health insurance coverage in Nigeria. So that is our main problem. So now we'll start bringing on. So what do you think are the causes of this problem? Please, you can also.
Can't hear you.
Sorry, please. I muted my mic. Please, can you hear me now?
Yes.
Okay, so we'll be looking at low health insurance coverage in Nigeria. So now what we are going to do is that when That's the main problem we are looking at. So you would now tell me what do you think might be the causes of low health insurance coverage in Nigeria? Just raise up your hand. Just raise up your hand. I'll call you, or you just write it in the chat box. Anyone you're able to do. So you can start now. Just start writing. What do you think is the causes of low health insurance coverage in Nigeria? Why is it that a lot of people are not insured? So I think I have a hand. So and one is please Chinedu, please. Sorry, you can go ahead, please.
Okay. Good evening, everyone. So to me, I think one of the problems are actually the poor knowledge of the existence of some insurance scheme. That is the fact that most individuals are ignorant of the fact that there are actually schemes that are established to cover for their insurances. Yes, for their health insurance. I think that is one of the problem.
Okay, thank you very much. So from the chat box, I'm seeing unemployment, ignorance, and low income, poor awareness, inadequate government policy, low education, lack of awareness, especially in rural communities, poor allocation funds in health sector by the government, low education of the population, lack of awareness and ignorance. The fund is high. Someone says high. Someone is saying bad politics. So lack of awareness on health insurance, poor insurance policy, lack of trust in insurance. That is it. Beliefs of people, inadequate legal framework, poor government funding for health insurance scheme. Yeah, these are very nice. These are very nice. So I think we have exhausted most of the courses already. So please, if you have any more, please just put in the chat box. I think that one might be more better. So please just put it in the chat box. Lack of political will. Please keep on writing and sending it in the chat box. So I'll give like 2 minutes. Shortage of healthcare workers. Yeah, that's very nice. Please send in your, just put it, shortage of healthcare workers, misinformation, poor healthcare coverage. I don't understand. Poor healthcare coverage, like how? Okay, lack of accessibility of healthcare services. Good. So now these are a lot of courses. There are a lot of courses, right? So I think we can end the courses now. So now let's look at the now what are the consequences of this low health insurance coverage? Please just write it in the chat box. What do you think? Death? Someone say death. What are the consequences? Death. What again? Please just put it in the chat box. What is it? High mortality rate. Yeah. Which other thing again? Please think. What do you think are the consequences? What is it? What are the impacts? Low economic growth. Yeah, that's good. Which other thing again? Low quality of life. Yeah, sickness, decreased labor workforce of economy. Yes, very right. Low productivity. Sure. Increased maternal and child mortality rates. Political apathy. Right. Poor health status. Very good. You can go ahead. And poor health outcomes, high mortality rates. You can go ahead. Which other thing? Out of pocket expenditure. Yeah, right. Poor access to adequate health care, low immunization. Very good. Outbreak of diseases, low standard of living. That's very good. Low healthcare accessibility, inadequate primary healthcare provisions. I'll give 1 minute for this again. 1 more minute. Capacity gaps in health insurance industry, low hospital visits. So I think we can spread of communicable diseases. Okay. So a lot of stigmatization and isolation of affected individuals. Good. So now thank you everyone for your comments. I hope all of you have taken notes of most of what people are saying, Andres. So now all of us have looked at the courses now, and the impact, the consequences now that it's here. All of us have seen that what low insurance coverage can cause, and what is causing the low health insurance coverage. Now, now you as a person and you as your particular community now. So there's, let's say you want to, let me see, let's say you want to do a particular program that will be able to target these causes that you listed. You said ignorance, you said, let me read them again. So a lot of you said ignorance was the cause. A lot of you said that the cause of is illiteracy. Most of it is lack of awareness. Some of you said there was no government, is here unemployment, ignorance, yeah. Some of you say low income, inadequate government policy, and ignorance and the rest, low education and the rest. So you believe that these are the causes of this thing: lack of awareness, low education, and the rest. So now, and for this time around, people are going to talk. So now, you as a person, let's say you want to create an, if you want to create an advocacy, you as a person now, like this, let's say you want to create an advocacy. Now, I don't want, I will use a program first of all, or an intervention to target this problem. And please, you should develop a program now, as all of you are. So you can say that your program is just like a, how will I say? And then I don't want to use the avatar program or something like that. Good. Just give it a name, and tell us what your intervention will target, the courses, at least three courses that your program will target, and how you intend on implementing those things. So let me say it again. You are going to develop an intervention program in your head now. You are going to develop an intervention program in your head. And this program now will be targeting all those root causes that you said. Now, they will target all those root causes, at least three of them, at least three of the root causes. Then you tell us how you intend on doing it. So I want hands to be raised now. So you can raise your hand now. Please, just think. That's why we call EquiQuest strategies. So you have to think. So please, can you think of something? If you think of something, just raise up your hand so that I'll allow you to speak. Okay, Lydia Ajala. So you can go ahead. Please keep on thinking. Yeah.
Let me try. So for low income, we can, my intervention, I'll start from how I can raise money. First of all, I have to reach out to the people and find out maybe their status, then create a way whereby my intervention will be something like a cooperative, gathering money from each, like ajo, or what do you call that? Maybe picking money from people in the community, pulling money together, whereby one person that needs to access a particular healthcare for a particular challenge can take money from that pool. So I don't know whether that's an intervention. That's something. Then for the lack of awareness, I have to create a program to reach out to the community level, as in I'm talking about my community now. I have to create a kind of an educational either through the community heads, reaching out to them, educating them, telling them about the plan that I have, about the AJO, the cooperative, the pooling of funds, and making them, trying to get their own, let me see, how they feel about it, then trying to encourage them that this would be a good idea for them to be able to access care and sell that plan to them. That's for awareness. Then what else again? What other
No problem. Thank you very much. So from what I heard you said, thank you very much for that. So from what I heard you said, like just a community-based health insurance. So where that the entire community can have a pool of funds whereby anyone that is sick in that particular community will be able to access those funds for their health. I guess that's what you are trying to say. So and also you're also looking at how you'll be able to create a lot of awareness and get the support of most of the community leaders in what you want to do. So that's actually a good plan that you plan on implementing. Now, the same way I talked about, and how will I say, this is a very complex process. You might have these good plans on ground, but when it is being implemented, when you try to now start asking people to start depositing funds and the rest, that might have a very big issue. Some people might not pay. Some people believe that you cannot be sick. They don't want to be saving money for sickness. They might believe that if you are saving money for sickness, you can be, that means you are calling sickness for yourself. Let me put it that way. So there might be a lot of problems with that. But generally, that has worked in some countries. So it's based on the context you are working. You might work in a particular community and that might work out well. But let me say it that way, but in your own, in another community, it might not work out that way. So I like the way where you said that you wanted to like get the opinions of people in those communities. I believe that is part of the needs assessment that you plan on doing. So that is also very, very important. So now let me put it in, before I call in the next person, let me put it in this way. So please let's present our ideas this way. So just say that I will have, okay, someone was, okay, let's say I will have an Agile program which will be addressing lack of awareness and which will be addressing lack of awareness and lack
That
of
that would be lack
funds.
of income.
Okay,
But for the awareness, you have to go out to educate them, to tell
okay,
you meet the stakeholders of the community who will also reach out to the people in the community. That
okay,
would be for education.
okay.
But
So
for the
you are
lack of
addressing.
income, that would be a way to create source of income to fund healthcare.
So thank you very much. So I'll call in the next person. I think the next person is Ibrahim. So Ibrahim, you can go ahead.
So I think I'm a nurse, so I think I will ask to stress on the point of that you have been raising as an example, that is high mortality rates. Let me take that as the problem. So high mortality rates, the causes, like
Wait,
even though
please.
there is,
Hello?
yes,
Please, sorry about that. Don't we have high mortality rates after? So I don't want us to do that now. If you can just stick with that because it's also part of it. That's problem 3. That's the C
or
part, high mortality and infant mortality. So if you have something on health insurance, so we can start with that before we go to that other one.
like we talk about health insurance coverage and we list various causes of the problem. So like most of the problem, we said there is low government policies. That is what I mentioned as my causes. So while talking about it, as a nurse, I believe that unrecorded data is a lost data. Like a data, it's something that you do and you didn't record it is tantamount as you don't do it. So there are government policies, but the problem is the implement. If there is no proper implementation, and is as a result of the monitoring and evaluation. So there is no proper monitoring and evaluation of the government policies. So that is why there is no policy, because any policy that cannot be implemented properly is as much as the policy does not exist. So I would suggest a better intervention. So the intervention that will best suit who I am and where I am is that of the media. That is the best intervention. You can decide to gather supporters through media. At least you can go to Facebook, gather supporters, start by dropping a comment regarding what is actually happening. Then you gather your supporters through that. Then I think that is the intervention. And if you do that, we'll be able to raise a motion. And once we raise a motion, if it reaches a certain population, we will be heard. And when we are heard, at least government will be able to do something about it. And that is my own.
Thank you very much. So from what you said, I think you were trying to raise a point of raising and increasing accountability amongst our decision makers concerning this health insurance coverage, so that you can use media campaigning and raising awareness among them, so that they will know that a lot of people are actually not insured and healthcare is not affordable. I believe
Yes.
that's part of it. So thank you very much for that. That's also very important. So I'll call in the next person. As someone raised his hand and the person took it down, I wanted to call the person just now. Okay, Bolale, you can go ahead.
All right, thank you very much. I will be talking on the issue of ignorance. For ignorance, I think from what Lydia said, that can also serve going down to the leaders in the community and talking to them to ensure that they mobilize members of the community to utilize health insurance, and also can incorporate going from house to house and informing these people one-on-one about the benefits of health insurance. And also media, I think most of these rural people, they utilize radio and stuff, so the use of media, especially radio stations, to announce and publicize about health insurance will also do. And on the issue of accessibility to these healthcare facilities, I think most of the primary healthcare centers and all these cottage hospitals, they really don't have access, or should I say, they are not like um, enrolled in these government insurance policies. So it would actually, I would ensure that the rural I will ensure that these rural hospitals, they get incorporated into the scheme, and the government actually recognizes them as part of health um, health body.
Thank
Sorry,
Okay,
I
thank you
think
very
that's
much. Yeah, thank you very much for that contribution, addressing that part of lack of awareness and this and speaking to most of the community itself, so that you understand why it's very important, and also primary healthcare getting a lot of people insured in their local communities. That's very important. So I think someone there's a comment in the chat box. I'll read that. So, and I would like to talk about the intervention to address the shortage of healthcare workers, increasing the retention of healthcare workers in rural communities by reforming and strengthening governance mechanisms through strategies such as improving remuneration, supporting healthcare workers, and as training, empowering communities to engage in primary healthcare, and support the retention of health workers, increasing awareness about mental health services. This is quite so much. We can provide incentives and support for healthcare workers in undeserved areas. I think most of the major points you are trying to stress here is about remuneration. I think this is a very big issue. A lot of people don't want, most doctors or healthcare workers, we don't want to work in a particular local communities because they believe that the remuneration, even if they are working in even the main hospitals in urban settings, the remuneration I've been complaining of that. Talk more of working in maybe primary healthcare clinic or the rest, maybe just the first class of primary healthcare or second or third. So they might have remuneration might actually be a problem. So this suggestion is actually good, whereby we're able to increase their remuneration. Now, this can be done either at the local community level or at the state level, whereby there might be more incentives. Maybe the government might give that if you are working in rural communities, there are particular, how will I put it this way? There are particular incentives that you get. Let me even give you, let me give you this scenario. Please, for everyone here, please, we'll close by 9:30. So just hold on, we'll close by 9:30. So, and in the next 7 minutes, we'll be closing. So, and for that instance, there are people that maybe I would like to state this because it's actually a problem. So for people may believe that and they are not workers, but I believe that if there be high remuneration for people working in those rural communities, a lot of them will be going. Let me give you a scenario. Let's say, like, let me just use an example of Maiduguri now, Borno, Nigeria, where there's a high level of insurgency. I assure you that there are certain organizations that are working there that their remuneration is very good, maybe some non-governmental organizations. Now, because of the high remuneration, a lot of people are going down back to villages where they are putting their life at stake, their life, not even, maybe you might be a healthcare worker going to a village. This is not like your life is at stake where you meet. A lot of people are putting their life at stake because the remuneration, basically, that might not be their reason. So that all of us may not think that they are just generalizing. Some of them are actually interested in doing that. But some of them might be, the remuneration may actually be very important to them. So they will like to be able to attend, they want to go to these communities because they believe that they'll be able to get enough information. I don't want to dwell so much on this. So I think we'll talk about the last point. Please, Olua Damilola, please speak. I think you'll be the last one. Then we'll move on to the next two. The next two, we'll talk about them together. So thank you. And Olua Damilola, you can go ahead.
All right, thank you very much. Okay, so the problem I have in mind is the high burden of malaria, for example, and the intervention program I would recommend is capacity building of healthcare workers that are most closest to community members. For example, PPMVs, proprietary patent medicine vendors, and community pharmacists. So what I recommend is building the capacity, strengthening their capacity to test for malaria and also provide treatment for malaria. So that would improve access to primary health care. It will ensure universal health coverage and also address the issue of high mortality that might have been caused by malaria. Thank you.
Okay, I actually like your points concerning the capacity building. For me, I believe that that's one of the most sustainable strategies they can use because, and let's even talk about, there are different classes of primary health care. So some of them might not necessarily need so much and so much skill. They might need a particular doctor, but it might not be maybe 10 doctors or 20 doctors at the particular community because these people are it's just small and issues that are very not too extreme that they are trying to handle. So if we can have these community workers, apart from that, those that are those local level, if those people can be trained so that they'll be able to handle those issues in that community, that will go a long way. So that is also a very good point. So to save more time, for the last point, the limited financial resources for PHCs and maternal and infant mortality, we'll quickly take we'll quickly take the causes and the causes now and the consequences. So please, in the chat box, just write down, we'll be taking the two together. So write down what you think are the causes of limited financial resources for primary healthcare centers in Nigeria, and also the causes of high maternal and infant mortality in Nigeria. Please, let's be fast about it so that we can close on time. So unemployment is a causes of low financial resources. Someone talked about unemployment. You can go ahead. Please, let's send in our responses. Bad government policies. Send in your responses. High inflation rates, poor healthcare coverage, corruption, embezzlement of funds, unemployment. I believe that this unemployment is going literally everywhere. Lack of resources, corruption, lack of resources, poverty, corruption, and the rest. Poverty too. Believe in herbal medicine, yeah. Enough financial resources, but are not channeled correctly. I like this point. There's enough financial resources, but it's not channeled correctly. It's not about how much, but how it is spent. And poor infrastructure. Okay, low financing from the government. Good. So now we'll take in anyone that is going to talk on limited financial resources and high maternal and mortality. So Tosin, you can go ahead. So that will save time.
Okay, thank you so much, Joshua. I actually enjoyed the presentation of our time. So I work with Federal Ministry of Health and policy and advocacy is our team, and that's what we do majorly. So all the discussion have been very wonderful all along. Yeah. So I've been advocate of not much resources being committed to the healthcare space because I believe that we have enough, but the challenge is the utilization of the fund that we have. I can tell you categorically that every year we return money back to the treasure fund in this country. They are not utilized. The minister don't release them because we have enough funds that come in from the NGO and non-NGO space into this country. Even the money alone, if we use that money in this country, is more than the budget of the country itself. I'm not talking about healthcare. I'm talking about every aspect of Nigeria GDP. So what we have as fund in this country is more than even for the country to borrow money. So how do we do this? I always advocate for this. If what we have now can be streamlined, channeled correctly, and one thing we don't have in this country is we don't have an accountability uh, accountability space. There is nobody that is holding the next person. So how do you spend this money? How is this fund going? So how do you report back about this funding? So and that's number one from the government side. Number two, most of this funding that comes in from partners, I mean the MNGOs, INGOs, all of those guys, there is no way of accountability of when those money comes into the country, where are those money diverted into? Now, for the policy that we have been talking about, there is what we call master plan that is being developed. Somebody mentioned something about malaria. I can tell you that any policy that you want to think about malaria has been developed. Just think about it, is already on ground. Okay, so but the challenge is how do we hold these people accountable about making sure that this policy are being followed and they are being initiated, and we can see we can have impact assessment at the end of time, and then we can have a good output as a country, and that's the challenge we are having. So for me, it's not limited financial resources for PHC. I was reading something just now about the enough resources we have in PHC, but people
Please,
are being
Tosin, can you reduce? We are left. We don't have enough
sorry.
time.
There is no time. Sorry about that. Yeah, okay. Let me just round it up from here. That what we just need to do is to rechannel what we have on ground. Then we'll be able to have more resources and a better output. Thank you, Joshua.
Thank you very much. I think we don't have time, so I think we'll be ending it here. So I've sent the post evaluation form in the chat. Please ensure you fill it from here. Please, I don't know if Jane is here. If you can see, go ahead. Please ensure you fill the form. If you don't fill the form, you won't be certified. You won't get your certificate. Please ensure the form will be open from now till 9:40. That's in the next 9 minutes. 9 minutes, yeah. 9 minutes, it will be closed. So please try and fill it up now. There are just few questions that I can easily fill out. I don't know, Jane, please, are you here?
Yes, I am. Can you hear me?
Yes, we can hear you.
Okay, okay. Thank you very much for that wonderful presentation. It was brief yet very thorough, and I really enjoyed it. And thank you everyone for staying this far with us. Our time is fast spent, and we are sorry for taking much of your time. I hope you have enjoyed the presentation, the conversation, and everything as much as I have, and I hope you have penned down things and jotted down things. Um, I want to appreciate us again for taking out time to join our first webinar. And as you know, this is just um, it's a platform, it's a policy and advocacy platform. So we'll be having this regularly. This is not, it is not a one time thing. So please, if you have benefited today, inform your friends, inform people in your school, and tell them about what EcoCare is doing. And please ensure you fill out the post-evaluation form. We'll send you your certificate, and when we do, please ensure you post it across the social media platforms and tag us. Our social media platforms are displayed on the screen now. Joshua, please can you display them? Kindly follow us on our social media platform. We are on LinkedIn, we're on Instagram, we're on Facebook, we're on X. That's that's Twitter, sorry, and we are Medium. So please kindly follow us on all our social media platforms and post your certificates when you get them and tag us. Please don't forget to tag us. And you'll be getting emails from us once in a while. When we have blog posts, you just look out, be on a lookout for our emails. We'll get in contact with you. And I guess that's all from my end. I want to really appreciate us once again for taking out time to join this webinar today. So I'll be handing over to the Managing Director, Joshua Alifa. Floor is yours.
Okay, thank you very much, very much. Please try and follow us. And please, we'll be taking a picture right now. So please, if you can open your camera.
Joshua, if you're speaking, we can't hear you.
Please, sorry, I was muted and I was speaking. I said turn on your
Oh,
camera. That was what I was saying. Please
okay,
turn on.
okay.
Yeah. Some people have not turned on their camera, but I've snapped most of the pictures. I've snapped most of them. So please, I'll share this to a group. Please, you can tag us and you can share it on your social media platforms, on LinkedIn, on Twitter, on Facebook. Just tag us. Our name is Advocacy Strategies. Just tag us. As she stated earlier, we'll continue to do this a lot. This is our first, or continue doing this. This is actually a platform where everyone will learn. We'll learn from each other. So thank you, everyone, and I wish you all a nice, good rest. I'll be closing the form as I stated. And please ensure that you fill in the form. Then I'll share the slides and every other information that you need in the chat, in the WhatsApp group too. So thank you everyone for coming and have a good night rest. Thank you everyone.